Hello, my name is Christina, and in this video, I will show you how GIDEON supports medical librarians and health informationists. If you are looking to provide your library patrons with the most up-to-date, evidence-based medicine database, well, look no further than GIDEON. It supports courses in over 20 different disciplines, contains interactive tools for anybody interfacing with infectious diseases, microbiology, virology, ecology, One Health, pharmacology, epidemiology, and I could really go on. GIDEON stands for Global Infectious Diseases and Epidemiology Online Network, and this is one database that is updated every single day. As a medical librarian or informationist, you have so many jobs to do, from supporting your patrons with research projects like systematic reviews, to conducting expert literature searches, to creating informational handouts, and so on. You have a lot on your plate. And so chances are having access to a platform that has been synthesizing data for the past 30 years could save you a lot of time. So just how up-to-date is GIDEON? Let's have a look. In the past 48 hours, our team made over 14,000 updates. And we are not just keeping up with the infectious diseases landscape and the outbreaks, we are keeping up with the new data that is being published every day. You might know that there is a new human pathogen discovered and written about every 2 weeks or so. GIDEON really keeps on top of that, ensuring that your microbiologists are able to identify that pathogen, even if only a single isolate is known. We do have a 3 outbreaks map for you to use. I will include a link down below after the video. And looking at content by numbers, you can see what data categories GIDEON has. So for instance, our 29,000 outbreak records go back to 1348 AD. Over 335,000 references, increasing every day. So this is really a robust data source if you're doing any kind of research. What I would like to do before we go ahead is just to show you real quick who is using GIDEON at the moment. So our customers include public health and government institutions such as World Health Organization, ECDC, NIH, Homeland Security, CDC, Pan American Health Organization, and so on, many ministries of health. In the educational area, you might know these institutions, and the list is quite long here. Point of care institutions like hospitals, clinics, travel clinics, corporate institutions, pharma, vaccine makers, microbiology labs, and research and technology organizations as well. Okay, so what I would like to do next is go through 4 typical scenarios that our customers face and explain how GIDEON helps solve them. For instance, let's imagine it's 2022 and your hospital is experiencing an influx of patients with Mpox. Mpox has not been known as endemic disease in your country up until now. How does GIDEON help with that? Well, the first thing you might want to do, you might want to find some information on Mpox. If we go into the diseases module here, we can find clinical summaries and information on agent, reservoir, vector, vehicle, incubation period, any diagnostic tests that are recommended for this disease, typical adult therapies. Again, we can click through to the anti-infective substance and find out their mechanism of action, typical dosages, warnings, toxic effects, interactions, and so on. Going back to the note itself, we can have a look at the vaccines, any clinical hints and reported case fatality rates, images galleries. These are very graphic clinical images galleries that can help your clinicians identify the disease, or if you have any students that you're looking after, learn about the disease presentation. Also, clinical findings section really explores in great detail all the possible manifestations of that disease, including atypical cases. We do cite extensively, so any statement that is made here will be backed up by a reference or a few. And everything can be downloaded very easily. A PDF can be emailed to a colleague or a peer that your patrons might be working with. Okay, so having had a look at that, you might wish to go onto the outbreaks map and find out what other countries are experiencing the outbreak right now. So let's imagine it's 2022. I'm narrowing down the year range, and here we have the countries and the outbreaks landscape of 2022. But what that could help you do as a hospital librarian is to really identify where the most endemic countries are, where the next case could come from, especially if you have an international patient population. Now, what else could you do? You could support your clinicians with a differential diagnostic tool. I have pre-populated this workup of typical symptoms that a 2022 outbreak was known for. And in here we have the location. So one of the features of GIDEON is that it really knows how common is each symptom in each disease and how common is each disease in each country. So it takes that epidemiological aspect into account. And in this case, we can see this particular probability. So like I mentioned, in your hospital, this disease has not been known as endemic. And so GIDEON has this first case scenario blinking that helps you identify diseases that are not endemic to your country, but are highly probable. And Mpox is one of them over here. So what I might want to do now, I might want to investigate further. I might want to add it to a comparison list or order lab tests to confirm this possibility. You can also ask why something did not appear. Why did suspected disease not appear on the list? This is helping us challenge confirmation bias and so on. Let's move on from this one. Let's see scenario number 2. A research group in your university is conducting a systematic review on COVID-19 on different regions, focusing on health equity disparities. So again, where we could start is going straight to the COVID-19 note. And now the research group is looking into different regions of the world. So we might wish to start with a worldwide note. This is going to be a global overview of the disease in different regions with all the applicable graphs and a ton of references. And I'm just going to scroll down really quickly to the bottom because this is a huge note. But if we go all the way to the bottom, we can see that we have 1,568 references here at our disposal. And these references have all been reviewed by our team, going through a robust evidence-based medicine process to identify the best data. So right away, you could provide your research group with this many references to inspect, or indeed a data synthesis that GIDEON has already conducted. And there are already findings to build upon when writing this study. Another thing we could do, we could go and visualize some data. So for instance, COVID worldwide. Now, GIDEON tracks all different regions, countries, states, and provinces for any given disease. And so what you could do here is really to put together different charts. What I've selected here is deaths, rates per 100,000, because we are looking at health equity disparities. So we might wish to see how different regions were adversely affected by COVID-19. And I'm going to generate the chart. And this shows that European region seemed to have experienced the highest rate of deaths in 2022. But before that, it was the Americas region. Now, we could go a lot more granular than that. We could compare country to country, state to state, and we'll do that in a minute in a different scenario. Scenario number 3. You've been asked to produce a comprehensive report on dengue in South America for a public health initiative. We could start again with the visualization module. So let me go to an outbreaks map and select dengue. Okay, and in here we see dengue outbreaks from 1780 to 2024. Also the current endemicity legend illustrating where the hotspots are in rates per 100,000 population. Okay, we can zoom in. We can, of course, extract this data programmatically. If you work with statistical data parsing tools, this can be really, really useful. Or we could click on a particular country and actually read one of the 25,000 country notes. In this case, it's about dengue in Brazil. The first thing it will tell us is when the latest outbreak has occurred and how many cases have been reported so far. Then we will get a nice historical overview of when the disease was first reported, what is the government of Brazil doing about tackling this disease. Again, any applicable graphs, chronologies, additional geographic notes per province. And going down, we'll find more graphs, prevalence surveys tables. We can sort them by year, by focus. Now, one thing that you might notice here is that we don't track data in humans alone. We also track data in animals. So prevalence in mosquitoes is very important from one health perspective in addressing the threat of this disease. And we can see bats over here as well. Seroprevalence surveys likewise, and then the outbreaks table. In the outbreaks table, you'll find robust referencing, also what's been known about the outbreak so far and what initiatives are being taken to tackle that outbreak. As with everything in Gideon, every page is exportable at a click of a button, or it can be shared via the email. So now that I've explored this, I might wish to create some graphs here. Maybe I want to compare the most endemic countries in South America in terms of their dengue rates per 100,000. So what I'll do, I'll add the disease, dengue, and then Brazil, Peru, Argentina, Bolivia, and Colombia. Just to compare apples to apples, I will select rates, and in this case, I want to see rates per 100,000 for cases in all those different countries. Okay, here we go. I'm going to hit generate chart, and this is a very nice chart that shows me the trends over time. We can also have a look at this in a data table because Gideon is AA accessibility certified, so anybody can really use this platform. And it is also screen reader compatible, just to throw it in there. I can now export this chart, put it in my leaflet, present it in a presentation, and so on. Let's move on to the last scenario. So let's suppose a microbiology student asks for help in finding information on all bacterial zoonotic diseases in the United States for the last minute assignment. Let's start with that task here. Okay, so United States is the country. We are looking for zoonotic diseases, so zoonotic reservoirs and agent bacterium, so bacterial zoonotic diseases in the United States. Gideon right away can produce a very quick list of 37 diseases from which the student can pick what they're interested in. So the task for the student is to really provide a comparison of phenotypic characteristics for at least 3 pathogens that cause zoonotic diseases in the United States and are bacterial in nature. And the student might pick something that they know very well: anthrax, brucellosis, and the infamous plague. So now what the student could do is go into the comparison table and look at those diseases side by side, but perhaps clinical findings are not that interesting to a microbiology student. However, fingerprint might be. So here we are comparing agent, reservoir, vector, and vehicle, and we can see the exact agents causing each disease. And then what we could do, we could actually add those pathogens into a bacteria comparison table and compare their phenotypic characteristics side by side. So instead of flipping through book pages, Gideon can help put together these things in seconds. And we could add 7 more pathogens here if we wanted to. So what this will show us is distinguishing characteristics. How are these pathogens different from one another? What is always present, what's never present? We can compare the entire phenotype. Now, of course, these are the pathogens that you will never work with in a classroom, but it is still worth knowing what they look like, what they do, what's their susceptibility to antibiotics. So, for instance, we could add all 3 of those in here in a spectrum and discover what drugs will be effective against them. If you are a librarian supporting faculty that delivers public health, epidemiology, microbiology, infectious disease courses, you might wish to introduce them to interactive tools that Gideon has to engage the classroom. And beyond interactive tools, what we also offer is free lesson plans. Free lesson plans are available download from the link that I will include down below. Feel free to help yourself to those. And I will also include a link to how GIDEON helps conduct systematic reviews. So thank you very much for watching. And if you would like to learn more about this wonderful platform, please do get in touch with me, book a meeting with me. Again, I will include my calendar link down below, and I would love to connect with you.